happened?
My hand got twisted by playing football.
Let's go to the clinic. Okay.
Because it's a bony area.
Sit down. What happened to you?
Then you shoot the ball in my head.
Where's the pain?
Worst. The worst.
No. It is tight in this time. It's okay now?
Yeah, it's fine.
The pain is more. Go to doctor and check.
Thank you.
Something about the injuries which are happening in our school. The boys clinic in GWS is getting around 40 cases of injury per day, which is quite a lot, and we should take precautions to avoid the sports injuries. The commonest of the sports injuries, and few are accidental also. Sports injuries can range from small abrasions to scratches, and medium injuries like sprains, and sometimes even fractures, which is a major injury. So the main tip to avoid sports injuries is to keep you fit. The first one is to keep you fit. You always have to be active and exercise your body so that it's flexible, and whenever you play sports, it's not getting injured. The second thing is to do a proper warm-up. So before going for any sports like contact sports like football or basketball, so you need to warm up properly so that your body gets prepared to face the activities you are doing it. And then to prevent accidental injuries, you have to be careful. Like you have to avoid unsafe practices like running in the corridor, doing some stunts, or seriously joking with your friends, and avoiding contact like that, serious contacts like that. So these are the tips to avoid accidental injuries. So according to the WHO, they say that the major injuries at school are happening between the ages of 5 to 17. So as the age increases, the chances of your activity increases, and that's why the number of injuries are also more in a teenage group. So as teenagers, you have to be careful regarding all these injuries at school, which can be prevented. So if you're not, if some injury happens, it's a major setback to the school children. Like you will miss classes and you will be handicapped for some period of time, so it will limit your activity. So later on there may be complications like your movement will not be proper, and you will not be able to take participation in sports as before. So these are things which you have to keep in mind. The main thing is to prevent injury. You have to keep yourself fit, and don't be a couch potato. You have to keep on moving and exercise properly. That's it.
Thank you. The stupid things boys do which result into an injury when they play a sport.
Excellent. Today's children, they are not aware of what is warming up. They don't understand what is warming up. Warming up is one activity where they improve upon the muscle tonicity. How? Muscle has a liquid which holds the muscle fibers. Early morning if you get up, it jams the muscle fibers. That is why your body feels...
Tim, don't record.
Your body feels... You can record. Your body feels very stiff, tight. Have you ever noticed it? When you wake up from bed. And if I tell you early morning, come on, go for this, it becomes slightly difficult for you to
Yes, sir.
Cope up with the activity. Why the muscles are not ready? Why the muscles are not ready? The viscosity is you can say absent from the muscles. What is viscosity? Which mobilizes the muscle, and that is the fluid in it, which holds it tight. You take butter out from the fridge. It's so hot.
Yeah.
You keep it on the outside. Slowly it becomes soft. Likewise, when you keep walking and doing some other activities and work, your body becomes more because the warming up takes place in the muscle and it loosens up. That is why always in a PE lesson I said boys go for 1 minute. Many of boys they look at me, if I'm not seeing them, they don't. They walk and they come back, said sir we have taken round. Not realizing the body is not ready and they play. That is how the injuries take place. Why? You are trying your level best. Okay? But the muscle is not ready. The neuromuscular reflex action reaction time is also not happening. So when these two do not synchronize, the muscle tears, and especially it takes place in the hamstrings if you're running. That is why early morning, don't go for short puts, don't go for javelin throw, don't go for triple jump, don't go for long jump, don't go for sprints. You can go for 800, you can go for 5,000, you can go for 3,000, 10,000, because these are long distance races. And you begin slowly. If today's child learns what is warming up, he will never get injured
In the future.
in the future. Yes.
So, and suppose during a sport, if someone fractures their leg or any part of their body, what is the first action you take as the head of PE?
First of all, I don't allow them to crowd up over there. As a result, when they crowd up, Zafar, please stop this one moment. Okay. Any injury takes place, first of all, straight away, I will rush for ice pack from the first stage.
Okay, so it makes the part numb.
What happens? Now I'll tell you what happens. As you said, fracture. The moment you feel there is anything happened,
Yeah.
Give me.
it could be a muscle tear, it could be a bone breakage in the bone. Then what happens? The blood flows.
Yeah.
First thing I have to stop that blood flow, and that will only happen if I put the ice pack there. It will constrict it. It will not allow the blood to move out. And straight away, take him to the first aid. In this country, the rule says straight away first aid or the ambulance. I can't do that. But I know that ice pack I can give. I know it. I know my job. I can fix it. At least the staying and all. If something happens, the blame comes on us. That is why outside accidents also, they don't bother, they call the ambulance. They just allow the patient to be there only. So first aid is important, ice pack is important to stop the bleeding.
So suppose.
And there should not be any movement there.
Okay.
They should be still.
Suppose.
Why movement? Any movement, muscle is already toned. The movements allow the flush of blood.
Yes.
So all the blood will accumulate and that will swell.
Suppose you and few boys are going jogging, okay? And a boy fractures his leg over there. And this is an abandoned area. What would you do? There is no ice pack, there's nothing, no first aid. What would you do?
I'll have to call an ambulance. I'll have to call someone who can give me help because I can't make him stay there.
Like if
As early as possible, I'll have to transport that fellow on my risk.
okay, what if you see one of your students taking a lot of trouble to breathe, or what if he
Breathing
cannot
problems.
breathe?
First of all, I'll clear them more. The tendency is to crowd the fellow. Why he will be, if he can't breathe, then mouth-to-mouth breathing is there. I'll start with that first. That is the only remedy that time.
So for how many years have you worked in this school?
I think you were not born. That time I started working 24 years.
24 years.
Have you ever experienced any of the situation?
I have not experienced, but I've experienced fractures and all that. Dislocations and fractures.
So how is the pain? How does it feel when you fracture? Because I have never.
Severe pain, severe pain. Suppose you go for injections
Yeah.
and hold it tight, you are worried. Now also if you go for injection, try to hold it tight because you will feel that pain. That needle pain is so much that you are holding it tight. Imagine that pain where the muscle is already torn and the fracture takes place. So when the doctors move that, I've seen ambulance come, they try to, it is full of pain, severe pain.
How, if someone's leg has been broken, how would you help it to prevent from the leg moving?
See, I can take a stick, I can take a wicket, I can take something, at least which I can, support it. And try go one hand here, one hand here. So that doesn't move and we can lift the stick along with the body. That movement will be less.
Okay. During the 24 years of your experience in this school, which was the most
Enjoyable or disturbing?
most disturbing injury you have seen?
Most, okay, it was long back. Long back in the sense, there were two injuries. One recently, 2 years back, and one I saw about 10 years back. When a boy was playing soccer and his metatarsal, the toes, I could see the bone popping out. And a boy was playing basketball recently 2 years back, class 11 boy. Whole of the wrist bone I could see it.
Good afternoon. What are the problems of warming up before the game?
Warming up before a game should actually not be a problem. It should actually facilitate and help in and before the game.
Okay. Now, what is lactic acid and how does it cause cramps?
Okay, lactic acid is basically what the body is. It's like the waste products that the body is actually keeping behind. And if you are not warmed up properly or you over-exercise, what happens usually with the lactic acid, it builds up, and this is actually causing a bit of constriction in the blood flow, and it can also cause muscle cramps.
So that's why it's hard for them to play and do their activities.
Yes.
What are the bad effects of steroids and the supplements of the athletes?
It depends what kind of steroids you're using.
And it's illegal for them, right?
Illegal, okay. Anabolic steroids is illegal, so obviously that's why it is not approved by most of the sports bodies. It breaks down muscles. It will build up muscles eventually, and then in the long run it will actually break muscles. It can also affect the heart and its pumping function, and it also breaks down testosterone in the body. So basically what happened with the muscle strings, they can actually snap in the process.
Is it possible the bones might snap at the same time?
Bones do get brittle over time in the long use of steroids.
Okay, what types of sport injuries are there?
There's lots of sport injuries.
Yeah, what's the most common?
The most common sport injuries is usually with a lot of contact sports like your football and your rugby. Injuries will be usually your knee ligamentous injuries like your what I call the ACL, the cruciate ligaments, and you've got different cruciate ligaments, as well as shoulder injuries and hamstring injuries, which usually, if you know about professional athletes, they get injured on knees, shoulders, hamstrings, even calf strains as well. They might be out of their sport maybe 6 weeks to 2 months or more.
Are athletes allowed to use knee extensions?
Knee extensions in which way?
Like for basketball players? Like sometimes they would want to increase their height in order to play better.
It depends. I think they only allow a certain amount of knee extensions. So they don't really. It depends if it is actually approved. And with the sports federation.
If there's a player who has a heart injury, what would the coach or the doctor recommend for the player?
If there's any heart injuries, this needs to go to a physician, that will be the sports physician, and without his approval that an actual athlete is fit, you will not be allowed to be on the field, whichever sport it is. Dietitian?
What are there any special diet routines sportsmen should follow?
No, not a special diet, but they have to include a variety of food in their eating pattern, and depending on the kind of activity level they do, their caloric requirements differ, you see. Yeah, and the intensity. And plenty of hydration, for example, yeah.
They do eat a lot of fatty food.
No, not a lot of fatty foods, because the main thing is they have to stay lean, they should not have too much of fat on their food, but they have to focus on having a balanced eating pattern, like balanced diet, balance of like complex carbohydrates, good protein, good fats, not too much of junk foods, stay away from, limited intake of alcohol in moderation, and plenty of fluids. And a small frequent meal pattern rather than having heavy meals throughout the day. Yeah.
So this is the best way to stay healthy is?
Yes, having a balanced eating pattern and eating more of a nutrient-dense food. When I say nutrient-dense, it will have more of nutrients but lesser of calories, you see.
Exercise is also important, right?
Yes, exercise is extremely, it's very important.
Should be regular?
Yeah, regular, yeah.
I have a question for you. I'm not sure if you can answer.
Right. The best of it.
How can sportsmen prevent heart-related diseases?
It's basically, with sportsmen, to prevent heart-related diseases or anything that will actually cause the heart to be affected, it's usually when you deal with extreme heat, extreme cold weathers, especially in Dubai. So heat stroke will be one of the biggest, contributory factors. So once again, if you're not dehydrated and you play a 90-minute football match, the heart will be affected. The muscles will be affected as well. So that is your main things, and as well, if there is any abnormalities, congenital abnormalities of the heart in a sportsman, that is where it's very important that they actually need to go through thorough medical exams, and that's the only way that I can actually, and I know for sure the guys are actually going like every 3 to 6 months, actually every 3 months they go for their medical test. Doesn't matter where you are, so it should be that.
Okay, now I have a final question for you two both. How can us teenagers be successful in playing a game without falling into
Sad diet.
any health-related problems?
Oh, okay.
Don't drink and do sports, don't smoke and do sports, don't take any anabolic steroids. If you have to do any supplements that will help the body, after all, is if it is approved. FDA approved, and if it is approved by whichever sports society you are in.
And don't follow a crash diet.
Yes.
Don't follow a crash diet eating pattern.
Like she said, you need to have a well-balanced diet,
Not like a high protein
rather
diet.
eat
Something
more
like that,
than big meals.
yeah.
So I'm going to wind up now.
Yeah, okay.
Thank you.
Welcome.
Thank you.
Hope it's good, guys.